Hello everyone, I am urologist Omar Makaya. Today I will talk about a drug called Clomid, which we use in testosterone replacement therapy. A new publication has come out on this subject, and it is a very good one. It seems to answer many of the questions I had in my mind. Some patients want to prevent their testicles from shrinking, their sperm quality from deteriorating, and their fertility from being affected. However, they also want to increase their testosterone levels. One of the medications we prefer in treatment protocols for these patients is Clomid. Clomid is a very old medication, we know it well, and it is a reliable medication. After administration, there is an increase in testosterone levels and free testosterone levels. But some patients said, I started taking it, my testosterone increased, I got good results in the first period, but in the next period, my libido did not increase, and I felt worse. We also use it in post-cycle treatment. We use Clomid to rehabilitate the testicles. But it may not be effective in some patients. A recently published study states we took 20 patients, administered Clomid, and found that IGF-1 levels decreased in 75% of the patients. What does a decrease in IGF-1 levels mean? It means that the effectiveness of growth hormone in the body has decreased. And it decreased in 75% of the patients. Okay, the number of patients in the study is quite limited, but the decrease in IGF-1 levels in 75% of patients, as well as the decrease in the standard deviation value below 2 points in 2 patients, shows a very meaningful result. In addition, a decrease in IGF-1 can cause loss of sex drive and fatigue in the body. It can also cause other complaints. It is also important to note that it affects fertility. In patients with low growth hormone levels, there is a decrease in sperm quality. Now another parameter arises here. Should we check IGF-1 levels before prescribing Clomid? Or should we monitor how low IGF-1 levels drop after a certain period in patients who have started Clomid? Should we support growth hormone in patients who are receiving Clomid for treatment, infertility, or PCT? Such questions have begun to arise. It was a good publication. Because I have actually given Clomid to some patients. After giving it, the patient initially responded well but then stopped responding, so we switched to testosterone replacement therapy. Sometimes this situation tied our hands. There aren't many alternatives to Clomid, to be honest, friends. Clomid is a selective estrogen receptor modulator. Tamoxifen might be considered an alternative. We don't know if tamoxifen affects IGF-1. There are no studies on this, and there are no studies on the effect of tamoxifen on growth hormone either. But I think this study yielded very good results. It really cleared up some of the questions in our minds, and it raised the question of whether we should add another treatment to the treatment protocol. Thank you for listening, best regards.